pericardial sac. Most of them is taken off, but that surrounds the heart, and between the pericardial sac and the heart is serous fluid, and you need fluid. You don't need too much fluid because then you get congestive heart failure, but you need a little bit of fluid in there. I don't know the correct volume, but you do need some so that when the heart beats, it decreases friction and the heart and the lungs don't rub together too much. Alright, but this is the pericardial sac that surrounds the heart. Again, the tissue of the heart is the pericardium or visceral pericardium, same thing as epicardium. This is the base of the heart. This is the apex. The groove right here, you kind of see it right here. It's just a small, a slight indentation. That's the interventricular groove. All right. This is the pulmonary trunk, the aorta. So you look at the back. Put my fingers through here, superior and inferior vena cava. And then you have to kind of find the opening. Okay, this will be a pulmonary vein, yeah, and that dumps blood into the left atrium. The heart muscle, where it looks more rough, that's called myocardium. And within the chambers, where the muscle is smoother, is endocardium. The myocardium that separates the left and right chambers, that's the interventricular septum. Okay, the left side of the heart, the wall is thicker on the ventricle wall. This is the left atrium. Below the valve there is the left ventricle. The valve on the left side is the mitral or bicuspid valve. Those strings are the chordae tendineae. The muscle it attaches to is the papillary muscle. On the right side, you have the right atrium, the tricuspid valve, chordae tendineae, papillary muscle, and then down here is the right ventricle. Okay, coming up from the right side, if you're talking about the flow of blood, it's going to come up and then pass, well, it's torn up, but that's the pulmonary semilunar valve, which is, well, you can kind of see one of my fingers pressing a part of the pulmonary trunk. If the blood was coming from the left ventricle, it would pass the aortic semilunar valve, and remember, the blood's going to run up to the aorta. Okay. Remember, the bicuspid and tricuspid valves are called atrioventricular valves. They're between atrium and ventricles. Atria is singular. Atrium is singular. Atria is plural. You can see the papillary muscle really good right here. Okay, so wherever the pin is, just look, is it above or below the valve? Is the muscle thick or thinner on the side to tell left and right and top and bottom? Tracing the flow of blood. So if the blood is coming from above or below, it enters through superior and inferior vena cava. Okay, it will be dumped into the right atrium. The blood will flow past the tricuspid valve into the right ventricle. Then it will come back up past the pulmonary semilunar valve, leave out the pulmonary trunk. Then you'll have left and right pulmonary arteries connected. They're cut, but the pulmonary arteries carrying blood away. That will take the blood to the heart, where it's going to pick up some oxygen, because the blood will have just come from the tissues, where the tissues use the oxygen up. And so once those left and right pulmonary arteries takes the blood to the heart, lungs, it picks up oxygen, and then the lungs will pump the blood back into the heart via the pulmonary veins, which most of them are cut, but you can see the opening. And then you see the pulmonary veins will dump blood into the left atrium, passes the bicuspid valve, goes into the left ventricle, passes the aortic semilunar valve, and then the blood will come up, through the aorta, and then go to arteries, arterioles, capillaries throughout the rest of the body, and then again come back through the inferior and superior vena cava. Now the blood that goes into the heart, so it's gonna go into all this muscle, called microcirculation. That will come back into the right atrium via the coronary sinus. So this one's open. Let me see. I want to say it might be this little part. Since it's open, it's hard to tell because I've never actually seen it. This is my first time seeing it cut. But it may be within this little area. If you feel it, you can feel how there's a little indentation. But the coronary sinus is within that pulmonary trunk. And then that's going to dump the blood from the heart back into the right atrium. Feel it here. I've never actually seen the coronary sinus, but it's definitely within. Like I can feel it here. It feels like I said, like a little any belly button. But I don't think you'll have to identify that. You can ask your TA to be sure, but I've never pinned it. I just asked for the function on the test, and it, like I said, brings blood from the heart and dumps it into the right atrium. And so that's all the parts of the heart. Do y'all want to go over the nephron and stuff?